Welcome back to Newsday. Thank you for staying with us. Akwa Ibom State Governor Umo Eno has approved the immediate release of the 2025 counter-funding of various interventions in health-related programs across the state. The State Commissioner for Health, Dr. Ekem John, said the funding covers related health programs including health insurance, primary health care, immunization, family planning and nutrition. The Commissioner highlighted major policy reform initiatives, noting that during the year under review, the ministry focused on strengthening infrastructure, improving staff welfare, training and enhancing service delivery aimed at producing better health outcomes. He also highlighted that the state government has done well in the area of leprosy and tuberculosis control. Akwa Ibom State Commissioner for Health, Dr. Ekem John, joins us now to discuss Governor Umo Eno's healthcare delivery initiatives. Good afternoon and many thanks for joining us here on Newsday.
Good afternoon and thank you for having me.
Of course.
It's my pleasure to be with you on Arise.
And it's a pleasure to have you here as well. Now, one of the things that we often hear when it comes to looking at the health sector in Nigeria is that we see a lot of construction when it comes to healthcare centers, but staffing often remains a huge challenge. So I'm just wondering how you plan to either recruit or retain the essential staff to make this a success.
Well, thank you very much, viewers and interviewer. Many people will recall that towards the end of September 2025, after a comprehensive briefing presented in the Executive Council meeting to His Excellency the Governor as Chairman in Council and highlighting all of the challenges facing the Akwa Ibom State health sector, the Governor approved the state of emergency. One of the issues that gained prominence and was highlighted then was the challenge of human resources for health. It's important to state that human resources for health challenge is a global problem. Even in the UK, they're finding it difficult to lock in their doctors. UK-based doctors are all migrating to countries like New Zealand, Australia, America in search of greener pastures where they are assured of better pay. And then while those from Africa and the Caribbean, Asia are then migrating to the UK. So it's a global problem. Here in Nigeria, we have a problem where people are not only migrating abroad, but people are migrating to big centers like Lagos and Abuja because we have a lot of big private hospitals springing up who are able to pay so much better than government's parastatals are doing. So it's a multifaceted problem which is both international and local. But one of the response under the state of emergency of His Excellency the Governor, which has come to stay in Akwa Ibom, is there was a holistic review of the welfare package for health workers in Akwa Ibom. As we speak, the Governor introduced 5 new allowances, which made it possible for healthcare professionals in Akwa Ibom State to be able to earn between 30 and 40% more than their counterparts earn in federal. So this is verifiable. These are things you can fact check. If you take the paycheck, for example, let's just take, for example, for somebody who earns 500,000 for that grade level within the federal structure in Akwa Ibom, the person will be getting at least 700 to 750. From 1 million, person will be getting 1.4. So whatever it is, you apply a margin of an increase of 30 to 40% increase. For the doctors, it's a 40% increase. For other health workers, it ranges between 30 and 37%. So that is in terms of retaining the people. Today, Akwa Ibom and Lagos are the only 2 states that I know who pay what we call retention allowance, colloquially referred to by health workers as JAPA retention allowance. So that's happening in Akwa Ibom, and the healthcare workers are very happy. The governor has received commendation letters from the Joint Health Sector Union, JOHESU, from the Nigerian Medical Association and the National Association of Nigerian Nurses and Midwives. We have an excellent relationship because of the governor's commitment to the welfare of people. So that's one step in retaining these people. But then in terms of adding more hands, because like I said, we admitted, and that was why a state of emergency was declared, that there is the challenge of human resources for health in Akwa Ibom. So what we've now done is we're in the process of concluding the recruitment. So you asked if we'd be recruiting. We have actually started the process of recruitment. People have written computer-based test exams because the governor directed that he wanted a situation where it can be said that in Nigeria, government did a merit-based employment. So what we have is that people applied for these jobs from all over, and then a minimum cutoff of 50% was set up. And so we had 33,000 persons sitting for the CBT across all disciplines, including healthcare. And then after the minimum cutoff of 50%, we have about 12,000 persons who would now appear for interview. Of the 4,000 persons coming into the civil service, the governor has dedicated 50% to the healthcare workforce. So we'll guarantee that between January and February, we'll be integrating 2,000 fresh hires into the healthcare system to respond to that challenge of human resources for health. But we're not stopping at that. The third prong to it, we realized that many of these nurses came into the service quite young, some of them 17, 18, and they retired at 52, 53, 54, because at that time, when you get into nursing school, the government pays your salary and it begins to read for you that you're already in service. So some of them are still strong enough and willing to work, and the governor has now directed that we should screen, do interviews, see those who are healthy, fit, strong, and willing to work, and we should engage them. Through that platform, we've concluded the process of taking in 1,300 persons. On Tuesday, during the ministerial briefing for the Ministry of Health, after presentation to His Excellency the Governor, he's directed that the Civil Service Commission should immediately, before the end of the month, issue out appointment letters on a contract basis for these retired but not tired healthcare professionals who are willing to come. So in the whole, we'll be injecting about 3,300 people into the system, and that is going to help. But within that period, we're also looking at other things within the state of emergency beyond the challenge of human resources for health. We're constructing, we're upgrading facilities, and we're bringing in equipment. Prior to now, the entire state had one CT scan, but the government has just ordered 2 more. The first of those 2 have arrived, and so in each senatorial district, we're going to be having those high-end machines to be able to help with advanced diagnostics. And so it's a holistic approach that we're bringing to bear.
Dr. John, thank you for that in-depth response. I wanted to just briefly ask you to touch on something from a patient perspective. So you've laid out the numbers, you laid out how you're retaining doctors, but from a patient perspective, what are you doing to ensure that the people that you hire are equipped with global best practices, have the knowledge to treat every single patient's issue, and if they don't know where to refer them? Basically, I'm asking, how do patients know that when they step into a hospital in Akwa Ibom, they know that they're getting proper treatment from an anesthesiologist, from a nurse, from a doctor? Can you speak to that?
Well, I would say, first of all, we do not hire people who are not qualified. The health sector is a strictly regulated environment where you're licensed to practice, whether as a doctor or as a nurse or as any person who is going to have to work in that sector. And so we hire only people who are best fit, but the place of training and retraining is quite important. And I can tell you for free that last year we mounted 19 training programs. That's nearly 2 every month. and these were all for health workers, and more than 2,000 health workers benefited from this training and retraining sessions, ranging from infection prevention and control, management of viral hemorrhagic fevers, and all of the, I will not be able to break down all of the training topics for those 19 events, but we had a lot of them, and you would agree that 19 is a lot under 12 months. So we're keeping at that, but we're also regulating the space. I've made it as part of my routine to visit hospitals on unscheduled visits for supervision, to correct what we call supportive supervisory visits, SSVs. So it's my own work schedule. It's not prescribed by anybody. It's just my own style of leadership. If I'm going to, for example, Okanafon, and I'm driving through Abak, I ensure that I stop at any hospital on the way of my journey, and just to take people unaware, see what's going on, and I can have a first-hand view of what's happening in our hospitals. Where we find lapses, we ensure that the rules apply. What used to happen previously was that people could just do anything within the healthcare sector and get away with it. You are aware that last year we had a scandal that broke out. Someone was in labor and was abandoned by the doctor, and there was only a nurse there to care, and she could only do so much according to her level of training, and then it led to the unfortunate demise of that patient. It was a death that shook the foundation of the state. The governor was deeply saddened, and throughout that night he kept on speaking with me, because I was on ground in the hospital to do a first-hand assessment. He kept on speaking with me till about 4 a.m. It was a sad moment for us as a state, but unlike what used to happen previously, we ensured that everybody who was supposed to be on duty and was negligent at his or her duty post had to face the consequences of the public service rules. As I speak, the doctor who was principally indicted has been dismissed from the service. And I mean, even after pleading, oh, could I resign? The Civil Service Commission insisted, because at the Ministry of Health, we had set up an investigative panel, and the findings were damning, and so they insisted that she had to be dismissed. And so there are consequences. Last year, we had about 5 demotions across board, doctor, nurses, and all of that. So right now, people in the sector know that much as you have a commissioner who is advocating for your welfare and pushing that you should be better paid, better treated, you also have a commissioner that is going to hold you to account. And I enjoy doing this job because His Excellency the Governor of Akwa Ibom State is giving me 100% backing in implementing these reforms. You know, it's one thing to be pursuing reforms, it's another thing for those reforms to be backed by the governor. So it is actually the governor that is saying that we must implement these reforms.
Absolutely.
And so I can tell you that when people walk into our hospitals, and let me just close by giving you an interesting statistic. So in 2022, we had 59,000 new patient visits in our hospitals. In 2023, we had 67,000 new patient visits. In 2024, we had 68,000. And in 2025, we had 483,000. That's a 700% new patient visits in terms of increment.
Dr. Ekem, it's very obvious that you're passionate about what you do. We applaud you for all that you've succeeded in doing, and we wish you well in all that you'll achieve in the health sector in Akwa Ibom State. Thank you so much for joining us here on Newsday. We appreciate your time and insight.